We all know what picky eating is. We all know adults or children who are picky eaters. While there are many official definitions of picky eating, a common one and probably the most useful one is where a person avoids a lot of foods, typically vegetables, but they could be other foods as well. Hi, I'm Praveen Goday. I'm a pediatric gastroenterologist. I work at Nationwide Children's Hospital in Columbus, Ohio, where I direct the nutrition and feeding program. The first thing to think about is this just picky eating or is it pediatric feeding disorder? There are big differences between the two. If a child has problems with actually chewing and swallowing, that child has feeding skill related problems and has pediatric feeding disorder. And if the picky eating leads to nutrition dysfunction, which means the child has malnutrition or completely avoids a food group or requires a high calorie beverage or tube feeding, that is no longer picky eating. That child definitely has pediatric feeding disorder and needs specialty help. Once that's not the case, then you can mostly reassure parents. There is a picky eating phase between 2 and 4 years of age, and as long as you do the right things or you recommend the right things to parents, many children will be okay. So what are those things? The first thing is children should be introduced to foods, especially vegetables, many times. The recommendation is at least 8 to 10 times, but also remember that parents offer a food like broccoli or Brussels sprouts just 5 times or fewer before giving up. They will come and tell you, my child will not eat any vegetables. But you got to repeatedly offer it to them to make them to accept it. The second thing to think about is using non-food rewards. So one of the things, if you are a parent, you have definitely done this with your kids. Eat this and you'll get dessert, ice cream, cake, whatever, right? But that doesn't work very well. The thing that works the best is non-food rewards. The simplest one is praise. Just telling them you've done a great job eating that piece of broccoli is fabulous. The other things you can do, which are easy, are things such as stickers and hugs. Surprisingly, in the literature, swinging a child around or raising them up in the air has also been described as being successful, but I wouldn't recommend that you do that during a meal or right after. The key things that can potentially prevent picky eating are: 1, breastfeeding. It seems like the tastes that flow through the mom's milk to the baby might help with picky eating. The second thing is introducing children to lumpy foods between 6 and 9 months of age. This definitely seems to help. The third thing is multiple repeated exposures. So you want to expose children to multiple vegetables because vegetables tend to be the worst group with regard to picky eating, and do it consistently and many times. The fourth and probably the most important thing is something called responsive feeding. This should start actually in infancy and go all the way up to, say, adolescence, when parents still have control over what their kids are eating. So what it means in brief is that the parent decides what, when, and where, and the child decides how much the child will eat. This can start from babyhood and go all the way up to teenage years. A twin study showed that picky eating was heritable in about 80%, 78 to 80% of instances. So that leaves us with 20 to 22% that we can work with and potentially modify. One of the things that I see in my clinic is some parents come and tell me my kid is terrible, will not eat any vegetables at all. And then I ask the parents, what do you eat? And oftentimes I get the response that I don't eat vegetables, but I want my kids to eat them. That's really not going to happen. So one of the things I tell pregnant women or new parents is you guys got to change your habits before your baby needs to start eating fruits and vegetables if you want him or her to be a good eater. One of the things that I frequently do with my parents is I direct them to the public library, and I have specific books picked out from my public library where I have already researched them. It's good for you as a general pediatrician to look at these books beforehand, look at the references and see if they're good before you recommend them. One other thing that I do is I recommend that parents visit healthychildren.org to look at the infant and child feeding resources on the healthychildren.org website.